Okay. Good morning, everyone. I'm very pleased to have been invited here to deliver this talk. My background has been working in tissue viability, and then 7 years ago, I came over to Wales to join their dermatology team. This study has been done as part of my master's degree. It was really brought about because of working with patients with the condition of Pyoderma gangrenosum and being struck by their plight. We know that Pyoderma gangrenosum is reported as an extremely rare ulcerative condition. The statistics say that it affects somewhere between 0.3 and maybe even less than that of the population. However, there is an indication that perhaps the condition is going undiagnosed and underreported, simply because practitioners aren't recognizing what they're seeing. The condition is poorly understood because people aren't truly aware what they're dealing with. So the primary aim of my study was to find out what is it like from the individual's point of view to live with this condition. And the secondary aim was to improve their plight, what I could perceive as being their plight. So, I undertook an interpretive phenomenological analysis using Heideggerian phenomenology. I managed to find 12 participants, and 8 of those were used for the study. They actually partook. I used a semi-structured interview technique with open question. So the participants were allowed to tell their tale. It was quite difficult from my point of view, having met these people before, not to interfere with what they had to say. So the transcripts were completely their story, what they had, what they experienced, what they thought were the issues surrounding their condition. We did do one pilot study, which I actually included in the study itself because this is such a small number of participants. I'm told that having 8 participants was actually a good sample. So, what we found was that in a lot of the literature out there, it will tell you that it affects more females than males. However, in this sample, the number is equal. I've got the same number of males and females, and the age range, pretty much the same. The majority of them were working people who didn't really have the time to be struck by this illness. So what did we find? Or should I say, what did I find in this study? Okay, so what I found, I identified 7 superordinate themes with a further 30 associated themes. I was quite overwhelmed by what I discovered from those transcripts. I'm thinking about excuse me a moment, I'm getting emotional at the thought of it. So, what was the major issue concerning these people? It wasn't the smell. Now, most of these participants, when they came to dermatology, you could smell them before they arrived. So were they concerned? Was the odour the issue? No. What we found, or what I found, was living with the pain was probably their biggest issue. This pain is all-consuming. there isn't a single part of their life where they can actually escape from it. Some of them get to see pain teams. Some doctors don't understand what they're dealing with. They can have an ulcer or a pustule that's barely 1 centimetre in diameter, even less than that. But the pain elicited by this is so intense, the patients will say that they can't escape from it. Some of them, when they've been given pain medication, have admitted to overdosing just to get a couple of hours sleep. This is just how bad this is. Other issues, contending with healthcare professionals who didn't know what they were looking at, didn't know how to treat it, didn't know what to do about it, or simply didn't believe them. Side effects of drugs. Some of the patients in this study had been on prednisolone consistently for more than 3 years, and as a result, had fractured hips as a result of osteoporosis. They also had gained weight from steroid use. They had poor body image. They had striae. Patients also reported headaches from the use of cyclosporin, all adding to the problem. What was the impact on these patients? Well, there was both a psychosocial as well as a psychological impact. So they became despondent. Every single patient, when you asked them what was it like to live with this condition, started with the sentence, "It's a nightmare." They all exhibited symptoms of anxiety. There was helplessness, problems with body image, lack of optimism, employment and school issues. These patients quite often lost their jobs or weren't able to attend school if that was appropriate. Relationships with their partners were affected because even if they were in a good relationship, the thought of personal relationships and sexual relationships were just out of the question because of how the disease affected them. So as a result, we had an overarching theme of suffering and despair. Let's move on. So in conclusion, the participants of the study described in vivid terms what it was like to live with their condition. A lot of them had experienced delayed diagnosis because people didn't understand what the condition was, and currently there's no gold standard for the treatment of this condition. However, in the secondary outcome, what we developed as a result of listening to these patients as part of this study was a synergistic medical management which optimized the care. So up until now, there'd been medical management with drugs, but no wound care involvement. So we put the two together, and this improved the outcome for all the patients. So much so that all the patients that took part in this study have now healed. It's recognised that early intervention and referral to dermatologists is important. Early intervention with anti-inflammatories such as prednisolone and cyclosporin is important. A paper by Aronovich et al. In 2012 identified the need for optimising wound care, but it doesn't seem to have been taken up by clinicians the same way as perhaps nurses do. The management of the wound bed is quite essential because when it comes to a neutrophilic disorder such as this, if you're not managing the wound bed, the bacterial load of the wound bed and the debris in the wound bed, that wound bed is going to send out pro-inflammatory signals, and more neutrophils are going to flood to the area, and you are going to keep a cycle going. So we need clinicians to dampen it down with drugs and good nursing care to manage the wound bed. If I can go back to my first slide, if it will let me. Excuse me a moment. This is a slightly atypical picture of a PG. It has all the features that you can recognise probably of PG. This was not of a participant of the study, but somebody who came along after the study was completed and benefited from what we learned. He presented at A&E and was sent immediately to dermatology. So we saw him from the start of this. This has only been there for 2 days. He was healed within 6 weeks. So I have my references, which will be, I understand, published. Any questions?